Hi everyone, my name is Elizabeth Oram and I did my research paper on the effects of the aging population on the United States healthcare system. So we'll start off with the introduction. So first we need to understand why this topic is important. So having an efficient and affordable healthcare system is a requirement for a sound economy and society. There's a lot of different factors that can affect a healthcare system, but currently the most critical in the United States is the aging population. And this graph is just showing that the elderly population is growing and living longer. So to understand the effects of the aging population, we first have to understand how older adults use the healthcare system. Then we're going to go over the aging population and how it will demand more healthcare providers and increase overall costs. Fortunately, there are solutions to some of these increases in the costs that can help reduce costs overall. So generally, older adults use healthcare services much more than younger adults, and this is mainly due to an increase in chronic conditions and the natural decline of the human body. So older adults visit their primary care physicians much more than younger adults, and they also visit specialists a lot more than younger adults as well, especially cardiologists and urologists. Older adults also visit the emergency room more than younger people. According to the Centers for Disease Control and Prevention, in 2017, the emergency room visit rate for adults aged 65 and older was 12% for injury, which you can see on the left side of this graph in the dark blue bar, and 36% for illness, which you can see on the right side in the dark blue bar. Within that range of older adults, people in the age group 85 and over had the highest visit rates for both illness and injury, which you can see in the gray bars. So the Center for Disease Control and Prevention also did a study that showed that patients 65 and older represent almost 40% of hospitalized stays, and this accounts for almost half all healthcare money spent on hospitalization total. So there's clearly a significant increase in physician, specialist, and hospital visits as people age. So it's vital to understand the common conditions and diseases that are causing this increase to improve the healthcare system. One of the major reasons for the increase in the use of the healthcare system is chronic disease. As you can see in the graph on the right-hand side, people ages 65 and older, around 80% of them suffer from one or more chronic condition, and around 60% suffer from two or more chronic conditions. The four most chronic diseases are heart disease, cancer, stroke, and diabetes. And all of those together lead to almost 2/3 of all deaths in 1 year. Heart disease is the leading killer of older adults, accounted for over 480,000 deaths in 2014. Treating chronic disease can be kind of tricky because physicians are worried about over-medicating. However, a lot of physicians have been leading more towards holistic approaches. A good example of this is the Chronic Disease Self-Management Education Program, which was developed by Stanford School of Medicine. And basically, they just teach patients how to deal with their chronic disease by coping with fatigue and frustration, improving strength, improving their communication skills, showing them how to eat healthy and manage medications. As the aging population affects the healthcare system, chronic disease plays a very important role because it sheds a light on what diseases will be affecting the majority of the population. So you can see on the left graph that the history of stroke, heart attack, and cardiovascular disease are all going to increase. And that's because older people generally have more problems with strokes and cardiovascular disease. So as there's going to be more older people, we'll have more instances of strokes and cardiovascular disease. It's also important to take into account that this will show us what doctors will be needed as the population ages. So on the right graph, you can see that vascular surgeons and cardiologists are going to be in high demand as well. So chronic disease is a very relevant issue for aging adults, but there's also many non-chronic health conditions that will increase their use in healthcare. Two of the main non-chronic health conditions include increased risk for falling. 2.5 million people ages 65 and older were treated for falls in 2017, and this was more than any other age group. Unfortunately, 1/3 of the people treated for falling will end up back in the emergency room within a year due to another fall. The second most common non-chronic health condition is influenza, or more commonly known as the flu. And although this isn't a chronic disease, it's a top 8 leading cause of death for older adults. So now I want to go over racial and gender disparities in healthcare needs. Research conducted at the University of Wisconsin demonstrated that there are many race disparities in healthcare for older adults, which are often related to socioeconomic status. As you can see in this graph, chronic disease in African American older people is much higher than any other ethnic group, especially in heart disease. And again, this is due to living in socioeconomically disadvantaged communities. Similarly, there is also a difference in healthcare utilization within gender groups. A study conducted through the Health and Retirement Study concluded that the healthcare needs were greater among older women compared to men. However, women had far fewer economic resources to cover the cost of healthcare. Healthcare disparities are even more prevalent in the LGBT community because there's a large number of lesbian and gay senior citizens who find it challenging to comfortably seek healthcare services. A survey conducted by the National LGBT Health Education Center in 2006 reported that more than 50% of LGBT baby boomers did not feel comfortable reporting their sexual orientation due to the fear of not being treated with dignity and respect. And due to this disparity, there are many cases of depression and anxiety within the older population of the LGBT community. Fortunately, the American society has been improving awareness and acceptance of all races and genders, but inequality is still a very relevant issue for physicians to remember as the population continues to age. So now I want to go over how aging population will affect healthcare costs. Healthcare costs will have a very large effect because the distribution of healthcare costs is strongly age dependent. As you can see in the graph, it starts really low when you're a child, rises through the adult life, and then it spikes once you hit 50. So the cost is highest for older adults. The most relevant healthcare cost for older adults is Medicare, which is one of the largest health insurance programs in the world. It accounts for more than 17% of U.S. health expenses, which is 1/8 of the total federal budget. And the aging population will have a huge effect on Medicare because so many more people will be using it. It's expected to increase from $540 billion to $1 trillion by 2024. So due to this radical increase, Medicare Payment Advisory Commission has been working to find a solution to reduce costs for older adults. Although there is no way to entirely counter the cost of treating an aging population, there are multiple methods that can help reduce healthcare costs overall. The first example is decentralization, which is the process of pushing care provision down to the person with the lowest level of education. So basically, it's the idea of doctors giving more responsibility to nurses and physician's assistants so that the knowledge of healthcare can be spread out, which will ultimately lead to decreasing the cost of healthcare. Doctors will also need to rely more on nurse practitioners, physician's assistants, and other lower-level healthcare providers. The next example is increased self-care. So hopefully through patients placing more importance on eating healthy, exercising, and avoiding smoking and other unhealthy habits, it will reduce the amount of in-office visits. The last example is technology use. So the use of technology in healthcare is going to greatly increase as the population ages, and a great example of this is telehealth, which allows patients to send their vital signs and other important health information electronically to physicians, so it can also reduce the amount of in-office visits. So in conclusion, the healthcare system for older adults is very dynamic and is hopefully changing for the better through education and teamwork as the population ages and more people's needs for healthcare increases. There's no way around the increase in cost of healthcare due to the aging population. However, through teamwork, self-care, and technology use, older adults will receive the care they deserve. This is my reference slide. I hope you guys enjoyed this presentation and learned something. If you have any questions, please leave it in the comments. And I look forward to watching your presentations. Thank you.